actually, before Mitchell starts, this is Ilona Frieden speaking. I thought I might just give a little bit of an intro to Mitchell, who actually is now Dr. Braun, Dr. Mitchell Braun. He's graduated from medical school and is an intern in pediatrics at Medical College of Wisconsin. And Dr. Braun is, when he was a medical student, became interested in PHACE and in pediatric dermatology. And one of the studies that those of us, Dr. Metri, Dr. Siegel, and many of us, have been asked over the years is sort of what's going to happen to my child when they grow up. And we had some sense of patients that we'd followed for a long time. I've been pediatric dermatologist for like almost 40 years now. So it's a long time, but we didn't really have answers. So the idea was to do this multi-center study that he's now going to present to you to really see what did we know. And this is important research. We would love to know more and do more studies like this, but I just wanted to give that as a little bit of a background. So it was in some ways an ambitious study because we couldn't just rely on medical records as we do for many of the studies we do. We had to really reach out to patients and get them to consent and say, yes, I'm willing to participate in this research and to be interviewed. And we also reviewed their medical records. So that was a kind of background of what this study really is. So we have to thank the patients who took the time and their parents. Some of them still are living at home for the effort that they put in too. Anyway.
So the study, like Dr. Frieden was saying, is now published, and we will kind of have links to the study after we talk about this, and so you guys can read it if you'd like. But I think also a really important thing about this paper is that we really envisioned it to give a little bit of guidance also for pediatricians, kind of the general doctors that you all will be seeing more routinely in many ways. So it can be really helpful to give this paper to kind of your primary care doctor to kind of help them coordinate care for your child and potentially yourself. Okay, so just some background on PHACE syndrome. I assume that many of you all know a little bit about PHACE syndrome since you're here, but it is a syndrome that affects the skin, the brain, and the blood vessels. It's an acronym. So the P is posterior fossa, which is the back part of the brain. There can be some differences there. The H is hemangiomas. A is arterial differences. C is cardiac or heart differences, and E is eye differences. It was kind of identified in the mid-1990s. And so because of that, we don't have all the information on what this looks like when people grow up, just like Dr. Frieden was saying. So studies in the past had identified a couple of different symptoms or signs that people with PHACE have kind of in adolescence and adulthood. And those included headaches that tended to occur a little bit earlier on for some of the people with PHACE syndrome, and then progressive arteriopathy, which is a fancy word, but basically just means blood vessel changes kind of in the brain or in the neck, some cavities, different learning differences, and hearing loss. All these studies in general were kind of small in number. And so we wanted to establish a little bit of a more robust study into these long-term kind of signs and symptoms. So that was our goal. We focused on kids above the age of 10 and into adulthood. The reason for 10 is because we kind of wanted to capture the more adolescent years. And just like Dr. Frieden was saying, we did a combination of interviews with participants with PHACE and their families, and then also look through all their medical notes and records and imaging studies. There were multiple sites involved, and it was a big collaborative effort. So in total, we had 104 people involved in the study. The average age was 16 and a half, but we ranged from 10 all the way up to 77 years old. And people were from the United States, Canada, and Spain. So I'll go over kind of the big highlights. Hemangiomas are a big feature of PHACE syndrome. Usually these occur on the face. they can leave behind skin changes. And although they tend to kind of get better within the first couple of years of life, the impact of those skin changes that can persist into adulthood wasn't fully known. So we did identify that 94% of our participants had some sort of persistent skin change. About half underwent treatment for the skin changes. And the next couple of slides are just these fancy graphs that look at the numbers of reported kind of outcomes that participants felt themselves. So we asked each participant the kind of how they would rate their own skin changes and whether those were kind of slightly different, which is this light green color, moderately different, very different, which is this yellow color, or extremely different, which is this darker green color. And the next couple slides just focus on the most common types of changes that we saw. So persistent color change, usually kind of a red coloration, was in up to 70% of the people we saw, so 7 out of 10 people. But the majority of people rated these changes as only like slightly or moderately different, and only a few reported kind of more severe kind of difference. Another common one in 38% of the group were changes in texture. So the skin can be either a little bit more wrinkly or a little bit more depressed in other areas. And again, the large majority, over half, reported that it was only slightly or moderately different than surrounding skin. And then finally, a common finding in about 20% of people was swelling or bulk underneath the surface of the skin. This can often happen when the hemangioma is deeper in the skin, not just on the surface, that red color. And again, slightly or moderately different was the main reading. Then we asked everyone overall how satisfied they were with kind of the skin changes that were left over from the hemangiomas. And the majority at, around 90% said that they were very satisfied or satisfied with the changes. A smaller number reported kind of dissatisfaction. And then we also wanted to ask about the impact that these changes had on self-confidence or kind of self-image. Again, the majority reported that there was no impact or only a slight impact on their self-confidence growing up or during the time of the interview. We did some statistics that helped to identify different relationships between kind of variables that we had in our study or the things that we were looking at. So if there was ulceration where the skin breaks down and the area starts bleeding, or if there were surgical treatments in infancy in the first couple of years of life for the hemangioma, those people tended to report a bigger impact on self-confidence. We're not totally sure why this is, but it is possible that it relates in part to some scarring that's left behind from both of these events. Okay, so that was hemangiomas. Another important part of PHACE syndrome is kind of the neurologic or brain findings. And so we'll dive into that next. So there can be brain differences. There can also be blood vessel changes in the brain too. So this slide kind of goes over some of the more general brain changes and not necessarily the blood vessel changes that we'll get into in a minute. So about 72% reported headaches. And this again has been found in smaller studies, but this is the largest study that's identified this in PHACE syndrome thus far. And the age of onset, kind of when these headaches started, was about 7 years old, which is generally on the younger side compared to kind of typical populations of children. And then 45% reported learning differences like ADHD or dyslexia, things like that. 39% required special education or individualized education plans. But there's a very big range in what this could mean for kids. So some only had very slight kind of modifications in the classroom for one subject, or just needed help in kind of speech. And then others needed a little bit more robust help. In general, only 4 participants in the entire study of 150 4 people had significant delays that impacted their daily life or severely impacted their learning. Talking about statistics again, we did look at a few kind of relationships with learning differences. So posterior fossa differences, which is the back part of the brain, and then the eye changes too that can be in FACE, as well as certain hemangioma locations, so kind of in the upper parts of the face, were correlated or had a relationship with the need for an individualized education. Okay, and then I wanted to just go into headache frequency, or the amount of times that people are having headaches in the cohort. So although 71% had headaches, which is a higher number, the majority had rare or just sometimes headaches, which we defined as either less than 1 time a month for rare, and sometimes was greater than a month, but not weekly. About 20% did have headaches at least once a week or daily or almost every day. And this chart here is talking about the length of the headaches, how long they lasted each time. And this was kind of an even spread. So some were just quick, less than 2 hours. Some were 2 to 4 hours, like kind of half a day. And then others persisted for a full day or even over a day. Many of our patients, about 40%, had gone to a neurologist or a brain doctor for headaches specifically. And this is talking about headache impact. So we asked people to what extent or how badly these headaches bothered them. 20% said didn't really bother them at all, very brief and easy to get rid of. The majority said a little bothersome. And then the remaining, this part of the graph here, was somewhat bothersome or very bothersome. Okay, so the blood vessel changes is something that many families have questions about. We identified blood vessel changes over time in a couple of people within the cohort. We only looked at people who had follow-up brain imaging studies, like an MRI. And so there were only 68 participants out of the total 104 who had follow-up imaging that happened after 1 year of life. Out of the 68, there were 20 who had some blood vessel changes that were progressive, which happened more as time passed on. The majority of these changes are more narrowed vessels, so kind of having like, if you can imagine a blood vessel like a straw, over time they get even smaller, so it can be hard for blood to flow through them. And then sometimes also with FACE, the blood vessels can kind of twist a little bit more than they should, and over time they can be progressively more kind of twisty. We call it tortuous. The average age for this to occur was 10 years, and it ranged from about 1 year of life to 19 years of when it was identified that the changes were happening with time. That being said, there's a lot that we don't know about this data, and we're not really sure how important these changes that we found in the 20 participants really are. A lot of them were pretty minor, and there were no symptoms associated with it. 6 of the participants, though, did have changes that we would think were a little bit more severe or concerning, and this could potentially increase the risk for stroke kind of in the brain because the blood has a harder time to flow through the vessels. Whenever we diagnose someone with PHACE syndrome, we get an imaging study of their brain in the beginning to kind of characterize or take a look at what their blood vessels look like. And we stratify or kind of break people into groups based on what we're seeing at the time that we diagnose them. So low risk means that there are only very slight vessel changes. We don't think that they'll have long-term difficulties. Intermediate or middle risk and high risk can be a little bit more worrisome. And all of these 6 people who had changes that we would think were concerning were intermediate or high risk. So it makes us think that those who are lower risk in the beginning may not have these problems, but it's something we're still investigating and looking into. And then hemangioma location, kind of the center of the face, and posterior fossa, the back of the brain anomalies, were correlated or kind of connected to these progressive changes. And very specifically for these changes, we are continuing to research this. So we're working with UCSF and Stanford to look at these images themselves to keep learning about these changes. In our study, we only looked at the imaging reports. So basically a radiologist looked at all of the imaging files and then wrote up what they found. We just read kind of that report and couldn't actually look at the images themselves. A lot can change in the imaging machine world. And a lot of what we potentially found in the reports may be related to kind of how the imaging machines change over time. It's a little difficult to know exactly what the changes are without seeing the images themselves. And so that'll be our next step. And then overall, there were some other findings. This is kind of a busy slide, so I apologize. So we asked people a bunch of different questions. There were reports of hearing loss and also some kind of ringing sound in the ears that could be bothersome or could also just be very easily ignored by some patients. About 23% or like 1 in 5 people had a lot of cavities, kind of over 5, or they just kind of defined it as many or a lot. And then this last section here is about mental health. So 30%, 3 out of 10 reported anxiety, and 2 out of 10 or 20% reported depression. And then importantly, about a third or kind of 1 in 3 people, 33%, reported that they had some kind of emotional concern that hadn't been addressed by their doctors or the medical team. A lot of these interviews happened during COVID, and so there's a lot that's going on in people's lives. We're not sure if the mental health part of this is related to PHACE syndrome itself or kind of situational, but it is important for us to always kind of think about mental health when we're trying to take care of people with all different types of medical conditions. And then quickly about fertility and pregnancies. 3 patients in the cohort had been pregnant, and they had full-term deliveries without any complications, and their offspring or their kids did not have PHACE syndrome. 2 out of those 3 who had been pregnant did report some infertility or difficulty getting pregnant, but they were ultimately able to get pregnant. And then the final aspect of the study that I wanted to talk about is that we did give quality of life surveys to the participants. These are formal surveys that ask questions that get into things like anxiety, depression, relationships, and ability to go to school and work, as well as kind of someone's overall health in kind of their own perspective and their own rating. So we gave them to all the kids. The parents were answering questions about their kids, and then all the adults who were in the study as well. So the highlighted numbers here are the ones that were significant, which means that there could be an actual difference between kind of this group of PHACE or this group of people with PHACE and kind of the typical general population. So global health, which is someone's overall health, was rated lower than that of just the general population across the board. So the kids rated it lower, the parents rated their kids as having lower global health, and the adults also rated themselves as lower. The adults also scored lower on ability to participate in work. Again, we're not sure if this is related to PHACE syndrome itself or if this is more of a product of kind of the time that we did the interviews at. So overall, most participants in the study were satisfied or very satisfied with the kind of skin changes that were left over from the hemangioma, although it was a very common finding. Headaches were also common and did have a big impact on some people. So it will be always important when thinking about growing up with PHACE to be on top of headaches and go to a neurologist if we think that the headaches are impacting kind of school and daily life. And then learning differences were more common than expected compared to kind of the general population. But there was a huge range in kind of what people were reporting. So some kids were in AP classes and doing everything, and then others were more kind of impacted. And it's difficult for us to know right now kind of who will fall into that bucket. So overall, this study has helped us identify kind of what people are going through in adolescence and adulthood above the age of 10. We hope that this can be really helpful for pediatricians and for families who have experience with PHACE to help them get the care that they need. And we still have a lot of questions that we have to answer and that we have to study. I just wanted to quickly highlight what's on the PHACE Syndrome community website. So if you Google it and get to the kind of main page, there's this research tab up here. It will bring you to a web page that has all the published research kind of links here. So the long-term outcome study is this top one here. And then we also have this study, the second one here, called Facing PHACE 25 Years Later. This is a study that some of us who were on the long-term outcome study worked on about 1.5 years, 2 years ago now. And it goes through the literature, kind of all the studies and the articles that have been published to date, and is a review article. So it kind of summarizes what we know of PHACE thus far. This is a good resource too, kind of for pediatricians and for families or anyone who wants to learn more about PHACE syndrome. And we very specifically went through kind of what we would imagine would be important for follow-up, going to doctors every year and what pediatricians and general primary care doctors should look for. So headaches will be really important to consider and think about all the way into adulthood, and think about referring to the brain doctors if the headaches are really severe. Hemangiomas are really common, and treating in infancy with medications is important. And then also treating those skin changes with lasers or other medications if needed is important for kind of self-confidence and overall satisfaction. And then repeating brain imaging studies is something to consider as well, especially if symptoms like headaches were to develop. And then overall, the relatively normal things that all pediatricians think about should always be on our minds as well. So how people are growing, whether we're meeting our milestones in our school and work performance. If there are any issues early on, it's important to get into kind of early intervention systems and programs. And then, of course, going to the dentist is really important, vision, hearing, and then mental health as well. Okay, so that was it. I'm sorry if it was a lot. We can definitely answer a bunch of questions, I think, at this point. Dr. Frieden, Dr. Siegel, Dr. Metry are all here, and we can go from there.